Get the vaccine, this is COVID-19. That is the title of an opinion article written by Steve Lisowski, a critical care nurse. In his piece that is gaining a lot of traction online, Lisowski gives a look at what it's like to be a COVID patient that ends up in the ICU and then goes on to die.
Lisowski was born and raised in Chicago, but now works at Salinas Valley Memorial Hospital in California. He joins us live. Thanks for being with us, Steve.
Thank you. Thank you very much for having me.
So this piece that you wrote kind of blew up because I think it's just this idea that you're writing from the perspective of a regular healthy patient, giving him voice to what happened to him while he was in the hospital. Is this someone that you base this on, or is this an amalgam of a bunch of people that you've treated?
Yeah, I would say it's more an amalgam of a lot of the cases that I've seen. And I really wrote the piece because I had seen a lot of posts about, oh, if you get COVID-19, you'll be okay. You won't have any real serious side effects. It's just like the flu, all those kinds of things. And I wanted to offer a different perspective of some of the suffering and things that I've seen in the ICU in my work.
Your piece is heartbreaking, start to finish. You take us through a journey from feeling, a slight sore throat to going to the hospital to being intubated, then saying goodbye to your family. Tell us how it came to be that you were asked to write this piece in the first place.
Ironically, I actually was not asked to write it. It was a response just to my frustration and my situation in which I had seen so many people getting sick that I basically just decided to compose that narrative. I'm a little bit of an amateur writer and wanted to just put something together that really hopefully caught the whole process and how severe it can be.
Give people an idea, just through your experience, how many completely people with no underlying conditions, healthy people, have you seen come in with COVID and die, and how many have not been vaccinated or vaccinated? Do you have kind of a rough idea?
Sure. Well, certainly the Delta variant has definitely caused a major uptick in cases. We're seeing a lot younger people, patient populace, and a lot more people who do not have a prior medical history. Before, we were seeing a lot of older people who had a lot of underlying, what we call comorbidities. We're not seeing that as much with Delta. We are seeing young, healthy people come into our ICU, and unfortunately, some of them pass away. The vast majority of people that we see are unvaccinated. There is a small percentage of people that we see who are vaccinated who have like an immunocompromised situation where maybe they're a transplant recipient or something like that. But the vast majority of cases are unvaccinated. The vaccine definitely works.
Steve, how are you and your fellow ICU nurses doing right now? Are you still energized to go to work? Are you feeling fatigue at all?
Yeah, there's definitely a level of fatigue. The surge that we were dealing with before really tired us out. Many of my colleagues, wonderful people at Salinas Valley Memorial Hospital, worked anywhere 60 to 80 hours a week. And probably April or so, we saw that calm down. And I think it's very difficult for people to think that we might be dealing with a similar situation. There's a lot of we're professionals and we'll do our job, there's no question. But there's a lot of frustration, a lot of fatigue. We will do what we're asked to do, but it's definitely a tiring situation. Many people I know, including myself, have had a number of nightmares and a number of, it's been very stressful. It's very stressful.
Well, thanks for all the work you do. You can read Steve's article at MontereyHerald.com. Thank you for joining us, Steve.
Thank you, Steve.
Thank you. Take care.
Here's a look at some of the other stories making headlines this morning.